Even your reproductive endocrinologists who are helping you get pregnant, they don't give a rat's ass that's related to autoimmunity because you know what? There's nothing they can do about it.
Dr. Maggie, hi. I want to tell you something. I personally found you while finding your videos talking about the link between hormones and autoimmunity. This is something nobody's really talking about.
Mhm.
So, what is this big link between autoimmune issues and hormones?
Inquiry minds want to know. Here we go.
All right, everybody. Thanks so much for joining us once again for Autoimmune Table Talk Live. I'm your co host, Anne Emanuel.
And I'm Dr. Maggie Yu, MD.
We want to continue the discussion of how your own journey led you to developing this program all around hormones. And really, you have a story involved with that we want to get into as well with your own personal journey. And it really starts before you were even born with your mother's pregnancy.
Yeah. So everybody at Maggie UMD, functional and holistic medicine, and creator of Transform the protocol and the Facebook group Transform Autoimmune Disease Naturally. If you guys haven't joined the Facebook group, go ahead and click the link above or below this video and join the Facebook group to get wonderful live content, bonus trainings just like this. And if you're watching from YouTube, please give us a thumbs up and subscribe to the channel. Instagram, give us a follow. Today, we're going to share my story about this. And you're absolutely right, Anne. It really starts even before we're born. There's a whole big world of genetics that I think it's really missing. And I think it's important to talk about it because it not only affects us when we look back at our own genetics, but it affects and impacts our children. If you have hormonal symptoms, autoimmune issues, and you feel ignored, I'd love as we go through, if you have questions or ahas or symptoms you'd love to share, go ahead and put it in the comment section right now below. That'd be super helpful. All right. So before I was born, when we
Yes.
look back, my mom lived in Hong Kong. And when I look back at my mom's struggle during pregnancies, if you think about it, she was only 18 when she had me, and I was born premature. So I was born almost like about 7 months, and I was tiny. They said my head was like a tiny little mandarin orange.
Oh my God.
And, premature birth, right?
And that's
Miscarriage.
your mom. That was your mom right there with you and your
Yeah.
sister.
And yeah. And I lost my mom to ALS, which we all now are learning more and more how ALS is linked with autoimmunity as well. So here's the thing. My mom had issues with her pregnancy with me, and postpartum after she had me, she was very, very sick, and very soon after got pregnant with my sister and nearly died because she was really sick and had chronic infection while she was going through my sister's pregnancy. It's not an accident that people with autoimmune disease like me have moms or dads that have autoimmunity and hormonal struggles of their own.
Mhm.
Postpartum on both children, my mom struggled with severe symptoms dealing with either infection or even trying to have a healthy pregnancy. And it's so interesting because, 30 years later, here I was going through the same rigmarole.
Right.
Yeah.
History repeating itself. And I know you'll talk more about it, but your program offers an opportunity for people to stop it in its tracks and to not have that repeated for the next generation. But your mom struggled with hormonal issues. And then you, once you hit your teenage years, also had issues.
Yeah, I mean, here's the thing. Listen to the story because now I've been through it. These lessons were paid for with blood, sweat, and tears. So wisdom isn't cheap. It's earned for and paid for. And when I look back at my own teenage years, now I can look at my own kids and now I'm able to help other people and their teenagers or their young adults going through this, right? So these are patterns that have been missed as I was growing up. When I was a teenager, that was a long time ago. Um, I mean, lo and behold, that teenager on the left there, that was me. And I was struggling with severe depression,
Mm.
anxiety, huge mood shifts, mood swings. My mom was like, get her to a psychiatrist, get her to talk to somebody. Like something's going on. Like my kid, I lost my kid to her hormonal mood swings. I think it was the first time in our family where there was actually mental health issues really popped up, and my family didn't know what to do with it, nor knew that it was hormonally related. At that time, I had no idea that I had Hashimoto's. My mom had no idea she has Hashimoto's, but yet it was showing up generationally. My mom during pregnancy and postpartum issues, and it was showing up in me as a teenager with depression, anxiety. Also, I was having ADD type symptoms. And I mentioned before my previous stories that as a younger child, I had a lot of ADD type symptoms, was the class clown, could not focus for the life of me. And then as a teenager, I had heavy periods that were irregular, a lot of cramping, and really just severe PMS and weight swings as well, back and forth. So these are some of the symptoms that are really common. And what I find is that when we are dealing with the men and women that are in our program, a lot of times their teenagers are suffering from the exact same patterns they are. So I always tell people that when you actually learn about how to test your hormones, what kind of patterns it is, it's literally like looking at your child and giving them, you took one for the team and now you learned it. And now you're going to apply that knowledge to your children and you're going to kill Godzilla while he's an egg 30 years earlier. So why not do that? Why wait till he's running all around town and like messing up your hormones postpartum, early menopause, whatever later? So it's a unique opportunity to really understand how hormones in a teenager could be very early manifestations of autoimmunity, especially if you're a mom or dad dealing with autoimmune disease.
Is it a
Yeah.
manifestation where it's kind of this warning sign of later on you may get this? Or is it also something that's helping to contribute to the creation of autoimmunity in you?
It's actually kind of both.
Okay.
So it's really interesting because there are a lot of common patterns that your doctors miss, right? They don't check your hormones. They put all our teenage girls on birth control pills.
Mhm.
They put 40, 50-year-old women and keep them on birth control pills, even though we know it increases cardiovascular, cancer, stroke type risk to give synthetic hormones at such high doses. But that's the only solution that they have. But the issue for me is that when you see a teenager, some of these patterns are already there, whether it's estrogen dominance, PCOS, there's multiple different types of patterns. Really commonly in teenagers, we see PCOS as one of the patterns, especially if you have an autoimmune disease mom or dad. And I'm just gonna make this fact really big. No other doctor have said this on the planet, and I wish you guys could really hear this. These patterns, especially like PCOS. PCOS is polycystic ovarian syndrome. And in a teenager, if you want to know what checklist for those symptoms are, we have a hormone checklist. Write the hormone checklist in the comment section and check your message request. We can get the hormone checklist for you where you can look at hormone changes at any age in a checklist, right? But if someone has PCOS as a teenager, did you know that polycystic ovarian syndrome is and will turn into prediabetes and then diabetes? And what is diabetes? An autoimmune disease.
An autoimmune disease, and people also don't realize that.
Well, that's the pattern that I see over and over again, and it's so interesting. It doesn't even matter which autoimmune disease you have. Like, I happen to have Hashimoto's, right? And that's not an uncommon autoimmune disease. Most people with autoimmune disease of any kind have actually autoimmune issues with their thyroid as well. It's just not diagnosed, and their doctors don't understand how to test and diagnose it. But here's the thing, if you have an autoimmune issue with your thyroid, then what's the likelihood that your immune system is mistaking other hormone making organs as a germ? 100%.
100%. We learned that from you because people don't realize that Hashimoto's is actually very much connected to hormones. You talked about how it's signaling to all of your hormone making organs to sort of malfunction in a certain way, right?
Correct. So if you're in Hashimoto's, this is just one example, one autoimmune disease, but we're going to talk about some case studies of any autoimmune symptom or diagnosis or no diagnosis. Okay. It applies to every autoimmune issue. Is that it's just a good example because your body's like looking at your thyroid and says, oh, you're German, I'm going to kill you. But the thing is, these cells look just like your ovaries, looks just like your adrenals, look just like your pancreas, which makes insulin. So this is why a lot of people with Hashimoto's develop diabetes. A lot of diabetics are actually Hashimoto's or autoimmune disease of the thyroid.
Okay, so we talked about your struggles in your teenage years with these heavy periods and
Mhm,
irregularities. And then you went on as a young adult during your
mhm.
pregnancies. Well, first, I
Yeah.
think you might have even had some fertility issues. Is that correct?
This is the thing. I mean, it blows my mind how many people don't realize that fertility issues and miscarriages are really linked with autoimmune disease. I had no idea. And even your reproductive endocrinologists who are helping you get pregnant, they don't give a rat's ass that's related to autoimmunity because you know what? There's nothing they can do about it. We had trouble getting pregnant in our family. That runs in the women in my family. And we also had miscarriages,
Mm.
right? And not to even mention that we also have kids who are going to be much higher risk of having allergy problems, eczema,
Mhm.
asthma, also spectrum disorder, ADD, you name it. That's my entire family.
You and I both have it. We both have children with those issues. And so
Right.
everything you're saying, it's not like you're making this up. There are case study after case study, and I know you saw them in your own private practice as well.
Well, and this is interesting. How this all started, believe it or not, guys, was that postpartum, both my pregnancies, I had severe symptoms.
Mm.
After my first pregnancy, I had mastitis, infection. People with autoimmune disease, way more chance of getting infection. I had a breast infection called mastitis, took an antibiotic, which then gave me a really bad secondary infection called C. diff, which instead of clearing like in 6 or 8 or 14 days, took me 18 months to clear because I was full blown autoimmune attack and had no idea. So my immune system was attacking my thyroid, my hair, my joints, everything. And I was just told, as a doctor, I was already a doctor then, oh, Maggie, this is normal after pregnancy. I didn't even have my thyroid checked. None of my doctors was willing to check my thyroid or for autoimmunity. It was as if, oh, this is normal, what
Mhm.
postpartum women are supposed to go through. No, it's not. Okay. None of that is normal. And so many of these signs are missed or dismissed
Mhm.
as normal postpartum symptoms. It's
You're
not true.
I was told the hair loss is completely normal, and almost all of my friends were experiencing something similar and being told that's just normal postpartum. But what you're saying is no, this should not be happening in this way.
Not all women who deliver babies have hair loss. And the ones that do, and the ones that have all these other issues, you better start to pay attention. That huge hormonal shift when you deliver the baby is triggering an autoimmune attack. I went into early menopause at the age of 36.
And
And
were you told at the time what that was just you were getting older, right?
yeah, I was told that, Maggie, you were just getting older. And I was like, no, no way. I'm 36. I'm not 86. So in my menopause, I actually had several patients who said, hey, Dr. Maggie, I'd love for you to read this book to learn more about bioidentical hormones. And I read it. It made total scientific sense to me. And there was no resource for me to learn about it anywhere. So I ended up calling a local compounding pharmacy, bless her heart, Denise, and I said, "Hey, I don't know anything about this. I don't even know how to test my hormones, prescribe hormones, anything, but I have myself and patients I want to learn how to help." She said, "Let me take pity on you. Let me take you under my wing." And she taught me. And that's how it started. And the interesting thing is, then I started finding out, oh, learning case by case, going through with this compounding pharmacist, and then finding out that naturopaths have some training in hormones. I started going to naturopathic conferences and learning, none of which is available to MDs. It's almost like I had to go in the down low in the back of the room, be like, I'm the MD, like, no, I'm an ND, I'm not. Uh, and I was like, this is a whole new world. And believe it or not, there were so few MDs in Portland at that time or anywhere in the US that was trained in bioidentical hormones. That was also the exact same time Oprah interviewed Suzanne Summers, and Suzanne Summers came out with a book about hormones. And of course, when you read that book, I'm not advocating that. Okay. But it raised up the bar to have the conversation is that women do not have to put up with this shit. There are testing, there is solutions, there are patterns, not necessarily that one, but there are solutions with testing and possibly prescribing hormones. So I started doing that. I became known in Portland for being a medical doctor that was trained and dispensing and evaluating women and men for bioidentical hormone treatment. So I was a hormone expert first. And interestingly, and what I found was being a hormone expert and prescribing hormones, which I took myself, that it helped maybe 70% of the people. But then what I realized was after a little while, 30% of people, I kept having to adjust their hormones and nothing worked. And they started to have other symptoms and they started to have weird symptoms that other people don't. When I pulled them off hormones or adjusted those, their joints would hurt or they would have really brain fog, depressed. They were having way more reactions to the bioidentical hormones than others. And I realized in myself, I was like, that happened to me. In the first 6 months I took bioidentical hormones, first 3 months I was like, "Oh," and then the last 3 months I was like, "That isn't doing it. I'm still losing hair. I'm still gaining weight. I'm still fat. I'm still tired." And I realized in that process, I figured out, "Oh my god, I have Hashimoto's, I have autoimmune disease." Then it dawned on me. I was like, "Oh my god, maybe these people that take bioidentical hormones that don't improve or that I have to adjust their dose a lot have more to it that's going on. Maybe they have autoimmune disease."
Mhm.
So I started testing. I
Yeah.
started listening, and I realized Heck yes, they do. And so, like them, I thought, okay, I'm going to have to attack more than just give hormones. So I started looking at can I do with autoimmune disease naturally? Because there are no natural tools in the medical world.
None.
Right? So I'm not going to get on chronic pain meds for my fibromyalgia. I'm not going to be like getting on Prozac for the rest of my life. Right. And so I looked at what natural things I could do for autoimmunity. I started implementing those. That's the five pillars, everybody. This is what Blood, Sweat, and Tears developed the five pillars. If
Mhm.
you guys want to learn what the five pillars are to turn around autoimmunity, that it took me the last 26 years to perfect. Type in the chat right now, five pillars, and we'll share the five pillars training with you. Go ahead and do that right now.